Now it's time to get your questions answered.
The number to call, 608-270-9933, and we have 2 lines open if you have a question for Zorba tonight.
All right, let's start things off with John in Deerfield. Hi, John. What's your question?
Hi. I have to have both my left and right hip replaced. But there's a difference of opinion between my 2 doctors. My primary care physician thinks I should have one done, rehab it, and then have the second one done. My orthopedic surgeon thinks I should have them both done at the same time and go to a rehab center for 2 weeks. I'm wondering if Dr. Zorba has any patients that have had to make this type of decision.
You bet. And I recommend having one done and not both done. And the reason is, what happens if something goes wrong with one? What if all of a sudden you've got some discomfort, you've got an infection, and then you don't have your good hip, which of course is still your bad hip, worked on. So I am very much for having one done when it comes to hips, one done when it comes to knees. I've seen complications occur, and if you've got 2 artificial joints done at the same time, that's bad news.
All right.
It's my recommendation.
Debbie in Janesville, go ahead.
Hi. I have a bad swollen gland that aches, and I've had it for a couple weeks after a nasty cough. Can I still get the booster, or should I wait still longer?
Absolutely get the booster. There's no doubt about it. Omicron is here. You know, it's a variant that spreads very, very easily. So it seems like almost everybody, you know, has this particular variant. And the answer is yes. Unless you have a fever, unless you're really sick, then basically you should actually get the booster. And a swollen gland doesn't mean you should not get a booster at all.
Okay.
All right, let's go to Pat in Wisconsin Dells. Hi, Pat. What's your question?
I have COVID. I was at the emergency room. I'm doing quite well, but I just found out that prescription Paxlovid was prescribed, but I don't know, what is that supposed to do for me?
Oh, sure. Well, Paxlovid is the drug that's used for COVID, and if you're an older adult, you have multiple medical problems, you know, even if you're younger, then Paxlovid is the drug that we give. It's a 5-day drug, well tolerated, can interact with a number of other medications. So you want to talk to your doctor about taking it. You want to check with your pharmacist to see whether or not there are some medications you should stop. For instance, atorvastatin and all the statin drugs that are used for heart disease, we stop during that time. But the answer is, it's a very good, well-tolerated drug, not innocuous, taken properly. It's the right drug to take.
I took it when I had COVID.
Yeah.
Because you have very metallic taste in your mouth.
Oh.
So that's one side effect.
Yeah.
But it knocked it right down.
Okay.
All right,
good
that's
drug.
good to hear.
All right, Sue in Madison, go ahead.
Hi, Dr. Zorba. I've been having intense pain since I've had COVID in 2020 in October in my left lower intestine. And now I'm noticing the last 6 months I am having white, clayish number 2, and it's really hard to come out.
Sure. Sure. Well, anytime you've got anything that goes on in your colon, you want to make sure that you're up to date with your colonoscopy, because something else can be going on. And if you've got a gray stool, there may be something happening with your liver. That can also be an issue there. I think any change in the stool, change in color, don't just say it's from COVID. It may be from something else going on. So that means talk to your doctor, find out what testing you should have done.
Okay.
And I mean, it's a couple years ago.
A couple years ago, long time. And you want to make sure, once again, we always want to be the fact that other things may be going on in our body, and so we don't want to just blame it on COVID. We want to think about the fact that sometimes going to that doctor really can make a difference, because you've got a concurrent disease.
Absolutely. Yep. All right, we are out of time. Thank you all for calling. We'll do this again next Thursday, so try calling back. Zorba, thank you.
Great to
My
see you,
pleasure.
Zorba. We'll see you next week.
Take care.